Time now for this week's Health Matters, along with physician assistant Lynn Szabo. We are joined in the Fug House this Sunday morning by Jamie Daugherty from Coastal Hospice. And this is an episode you've been wanting to do for a while. Is that correct?
Yeah.
Yeah.
I've been chasing them up there for a while. And I think it's important not only because this is a new resource here in town, but I think there's some specific things that Del Norters should know about hospice care and how they can do the best for their loved ones who are at home, in the process of passing away.
It's such an important time. Earlier, you'd referred to it, what a family goes through, what people go through during when somebody is in hospice, is just running around with your hair on fire. Because I imagine it's not something that people have a lot of hands-on life experience with, the end of life.
No, and they're scared. And they're trying to do their best. And they live in Del Norte where resources are not, we don't even expect things to be available. But this is a super good resource. So I asked Jamie to come in and kind of talk to us about it. So Jamie, starting off, can you tell us how long you've been here and what your goals are for the community?
Yes. So Coastal Hospice has been in Del Norte for just about 1.5 years now. And our goal in coming to the community was purely a love for this community. We are based out of Brookings Coastal Home Health and Hospice, and we've been there for quite a long time. Hospice started there in 1997, and so we would get phone calls from Del Norte, and this silly imaginary state line kept us from providing and doing what we love to do for our neighbors. And so we worked very hard, diligently and painstakingly with the state to get our license and be able to provide this for Del Norte.
Yeah, and Dr. Patel, which
Dr. Patel?
Which one? Is
Junior.
Mm-hmm.
Junior Patel. That's
what your medical director, and I was happy to know that he's also licensed in California because it makes prescribing a lot easier.
Absolutely.
And access to meds a lot easier. Now, I went through this traumatic time with my mom where I saw failure as a hospice, but a really positive time with one of my patients recently, and it got me thinking about what's the nuts and bolts what are the things that Del Norters who have a family member going through this journey at home, what are they the most scared of? And I identified 3 things, but feel free to jump in. But the first thing is they look to their provider to be in charge, but there really isn't a great way for a provider to be in charge. Most providers don't know. Secondly, they look for pain control, super important. And again, most providers are kind of deficient in the ability to treat end-of-life pain. And then the third thing is they look for answers to very practical questions like, what do you do after the person has died? Or what do you do as the person is dying? Who do you call? What can you expect? Things like that. So the first one, how do you guys feel the primary care provider's role? What is it that you do when you send a nurse out and you're doing an intake on somebody?
Well, the first step when a nurse goes out is really answering a lot of questions, and the nurses and the whole staff have a very good understanding that fear of the unknown is what drives all of our anxieties, right? And so there's a lot of questions that we answer, and we do it multiple times. Okay. We leave papers for them to review when they are just having some quiet time but want some answers. And, we discuss with them what their wishes are. With the PCP, the patients get to choose who manages their care under hospice. They can decide to stay with their PCP if they'd like, or they can choose our hospice director, Dr. Patel. And so knowing they have that choice is, very, very liberating, in that's how we start the care with choices, and that's how the entire, journey goes, is with choices.
Absolutely.
And so we don't direct anything. We just give a lot of choices and let them decide how they want their journey to be. Most people do choose our hospice director because of having that specialty knowledge. We do communicate with the PCP on twice a month. Mm-hmm. We send them paperwork based on meetings that we have, and so we keep them involved. And then when a person passes, we update them as well.
Can I say that the initial contact I got from the nurse who was doing the intake for the recent patient I had that passed, he called me at 6 p.m. on a Friday, and then at the end of the conversation indicated he would be in the home with the patient until morning.
Mm-hmm.
And I was blown away.
And that was somebody from Coastal?
Uh-huh.
Wow.
Absolutely.
That's something. Yeah.
Absolutely. And I've talked actually to his widow, and she also kind of enforced that's something she was super grateful there.
Wow.
Especially in the beginning, because it kind of helped her know what to do. Mm-hmm. She was pretty lost.
It seems like, that would be, I'm sorry to jump in. I know we've got 2 more points to hit, and I don't want to lose track of those, but Jamie, is there like an overarching approach that maybe Coastal Hospice has? You're coming into or maybe it's just in the industry wide, but how do you come into a situation like that? Is it dependent upon the personality and the experiences of Dr. Patel, who sort of sets the stage for how an organization like Coastal Hospice works, or is there like an accepted standard operating procedure for hospice when you come in and sit down with somebody who's facing this incredible transition in their lives?
Dr. Patel is like the man behind the curtain. You don't really see him, but he is integral into everything we do. But the nurses are the ones with their experience. Our nurses are so experienced that they walk into a situation and assess it and determine what that family needs. Right. Some of them just need, a real short visit. We're just going to address a couple of things today. We're going to get maybe pain under control, and we'll be back tomorrow when you're ready to hear more. Or they say, you need me, and so I'm going to be here for you until you guys are okay. Wow. So it's very, very dependent on the patient and family and just the dynamics that are going on. Sometimes they don't need the nurse, and maybe they need spiritual care, and so we get that person out as soon as possible. And so it's very, very team approach.
Is there something you look for when hiring a nurse, a healthcare giver?
Yeah.
It seems like it would be a specific kind
training.
of person. Yeah, or some sort of specialty.
Yeah. Compassion, for others is going to be number one. Hospice is a calling. Really it is, because most healthcare, nurses included, is about cure. I want to make you better.
Right.
And that's not the goal for hospice care. The hospice goal is comfort and making sure that we address all of your symptoms holistically, not just medication-wise, but your spiritual pain, any of those kinds of things. We have a social worker for emotional pain. So it's really just about comfort, which that means that the patient is in the driver's seat.
Right.
Yeah,
right.
Going into pain control. Mm-hmm. Yeah. I felt like I was giving this particular individual huge doses of medication, opioids specifically, and it was not touching it, and he was actually using 2 or 3 times the amount that it was prescribed, so he was burning through it really fast. Mm-hmm. And then, of course, that is hard for the pharmacies to respond to, and they're thinking something inappropriate's going on. And then this Coastal came in and just reorganized his whole pain strategy, let me know what they were doing. And they also actually addressed this anxiety, which I think is all part of the same ball of wax. And he was comfortable.
Mm-hmm.
And he was at peace. Mm-hmm. And that is another thing his widow was super grateful for.
Mm-hmm.
And I would imagine that's complicated because of the state lines. But
no, it's not.
no, you guys have kind of jumped through the hoops already and gotten it all set up.
Yes, we have. So we use a mail order pharmacy primarily, and that's a specialty hospice pharmacy. So they're very familiar with the dosing and the high volume dosing and the kind of the cocktail dosing. So that you would not find in any other circumstance. But they are a nationwide pharmacy, so they go to all 48 states. I'm not sure about Alaska and Hawaii, but I know that they do the 48. And so they work well with California, and we've done all of that we need to do to get patients medications quickly. And then we use local pharmacies as well.
It was super quickly. I think it was almost the next day.
Yeah. It's next day medication delivery. And so the state line, even though in the beginning took some time, I mean, we've gotten through it. So we're definitely not having any challenges getting those medications, but our doctor and our nurses are incredibly experienced with pain, and realizing that pain is complex and it's multifaceted, and it's not necessarily a narcotic that's going to be required to take care of this pain. And so they assess them and, just ask them lots of questions and relay that to the doctor and get them on the right mix. And, we're there frequently. So if it's not right, we fix it.
Yeah, I was super happy about that because they did address his anxiety. And I think patients say pain, 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 and providers think pain, pain, pain. And the anxiety part of it was not on my radar.
Right.
And I think that was the key, actually, to make him the most comfortable.
Absolutely.
Yeah. So I appreciated that from his care. And I would say my mom's care was not as oriented toward her anxiety, and I think that could have been better. So I understand the nurses and also your physicians and other providers have special credentialing in hospice, especially as far as the pain medicine? Is that true?
No, not necessarily. Okay. Dr. Patel is board certified geriatrics and has extra training in hospice and palliative care. But our nurses have been working in Oregon, so they're not new to the area or to hospice. Once we crossed the border, we just kind of enveloped Del Norte into our operations. And so even though it's a new company, it's not a new business. And so we just continued doing what we were doing well for so long and expanded our area. Good.
And then the third thing that I saw is, there's a lot of family members who have never gone through this before, and it can be kind of terrifying, and it confronts one's own personal issues about mortality, and especially the process of dying, of what they call active dying. Can you define that?
Well,
what do they mean by that?
Yeah, so hospice starts with the terminal diagnosis, right? We're all familiar with this 6 months or less concept, but when somebody goes on hospice, we're really looking for signs of transitioning to active dying, and that's a different type of breathing. The organs have started shutting down. They're not really eating or drinking anymore. And so those kind of signs, which the nurses teach the family to look for, that's kind of starts to happen. And we're looking at, maybe 7 days, give or take. It could be 1 day, it could be 20 days, but, the average is kind of around 7. So that's, more of your active dying area.
And I think that's might be scary for some people to see that.
Very scary, especially if they don't know that that's what's happening.
Right.
If they haven't been told, because your average person doesn't have any experience with people passing away.
Right. And then, for me as a clinic provider, if I got the word that somebody was having that, my initial instinct is, well, call 911 and
Right.
get them to the ER.
Yeah.
But that's not what's supposed to be happening here. This is like a slow letting go.
It's a very natural process.
Right. It's a physical process.
Yeah.
It's something. It's not an aberration. This is what you're supposed to be doing at that point.
I mean, really, honestly, our bodies are amazing machines. And, the process of childbirth, the process of puberty, all of these things are natural processes. Passing away is, our last final natural process. But we're not exposed to that in real life or even in media. So we just don't know what that looks like.
We try not to think about it. I think a lot of people push it away. Mm-hmm. Although I did see one fantastic death in the Castro, a man who died of AIDS, who was a local entertainer, and there was a party going on around him as he passed, which is exactly what he wanted.
That's amazing.
Exactly.
Will Coastal Hospice provide the party supplies for my end of
Well,
life?
The disco ball.
We do some pretty great things.
Yeah. And it still makes me smile to think of that definitely was his scene. So,
How much variance in the experience is there for the patients? For the patient taking part with working with Coastal Hospice? I mean, can you do things like throw parties? You mentioned before, like spiritual care and organizing spiritual care. What sorts of sort of out of the box sorts of things have you guys had to do?
Well, we had somebody who had family in the South, maybe Mississippi, that a couple of granddaughters that she wanted to see before she passed. And so we arranged for their transportation to come see her. So, we try and do those kinds of things, fishing trips, or, sometimes it's just the beach they want to see. We do what we can. We're not exactly Make-A-Wish type of a place, but if we can manage it, then we do it. And then there's also, after somebody passes, there's special requests, green burials, or those kinds of things that we've done. Yeah.
Yeah, that seems to be kind of above and beyond or off menu sorts of things. That's interesting. Wow. How much is it? Is that difficult? Is that built into the business model? Is that built into the industry? Where does that ability to meet those needs come from?
Again, it's really the compassion of the team and the clinician, and the communication and the trust that they've tried to garner through that encounter. So we first need to learn of it. They need to trust us enough to let us know that they have these types of wishes. And then we get that to the team and we get our heads together and try to figure out how we can make that happen. Wow. Is it, we're not doing trips to the moon, but we're doing what we can.
I imagine as with any industry, there's a wide variance of the sorts of service that you can find. How can somebody with the possibility, and I know this is something when you're in it, I imagine, Lynn, if you're in it, you're not thinking about shopping and comparing, but how can somebody, what would put your guard up if you were encountering in a hospice organization and you thought, oh, hey, maybe I don't want to deal with these people? What should people look for?
Well, you want to be heard. If, if the person that you're talking to is not listening, if they're not hearing what you are asking for, and they just, their show, that is not what you want.
Right, right.
Absolutely. Because that means that they're trying to fit you into their box instead of the other way around, right? And so that's a major red flag pretty much from the get-go.
Yeah, that makes sense.
And then Lynn, what you mentioned with your mom, you said in Central California?
Yeah, Bay Area.
Yeah. If they're not communicating at all,
No.
then that's also a big red flag.
Yeah.
We are frequently out there calling and checking in. We have a social worker and bereavement and spiritual care. And we have volunteers. We have enough people that could be out there probably 4 or 5 days a week.
Wow.
So, if you're not getting that, that's a red flag.
And also another thing I think that just occurred to me while you're speaking too is that you guys have been here for 25 years. You've been in the community. Brookings counts for us down here too. You've been in the community, so it's like an established business. So
Absolutely.
it's not somebody coming in just trying to make a quick buck. That's wonderful.
No, that was, we're a nonprofit, and the board of directors was very passionate about wanting to get this service for Del Norte.
Wow. Can you speak at all about the beginning of the business? Was it just Was it just Dr. Patel's idea? Was there a
No, it wasn't him. And wait, you're talking about California.
not California. No, just going back in Brookings, back in
Okay.
the 90s,
So it was Dr. Silver at that time. He was working for the county. And it was him and the county that added it to home health, because they already had home health since the mid 60s.
Okay.
And so they added the hospice to the home health. And that was Dr. Silver was a big part of that.
Wow. Okay. All right. That's interesting. That's a different sort of a origin story than just being a private business.
Right,
Right.
yeah.
That's cool. Wow. Okay.
So I have a question about it kind of after the death. I know from my time in the Castro that caretakers and partners and family members it's kind of like taking care of this person is your whole life, and it gets very, very intense, and then it stops.
Yeah.
And maybe you've got a little bit to plan, like funeral arrangements or something like that. But then there's like this huge hole in your life. What kind of support can you offer?
Is there any
with
support
somebody
for that?
who's
That's interesting.
You could say it's grieving, but it's not only grieving. Do you have like ongoing after death for the people who remain?
Absolutely, we do. It's called bereavement, and we stay with them for 13 months.
Oh my gosh.
We do have a support group twice a month in Brookings at our building there. We are working on getting one for Crescent City. That's still a work in progress, but we do that twice a month in Brookings. We also reach out to them after the death, and anybody that they have the patient or family has indicated is their caregiver is who we reach out to. So they don't have to be related. They don't have to be living with them. It could be anybody that's important to them in their life that cares about them. And we send them, periodical mailings, just, we're thinking about you. And we just want to make sure that they're going through that grieving process in a healthy way, because it is possible to grieve in an unhealthy way.
Right.
Exactly.
That seems so important and kind of counterintuitive at the same time. I wouldn't have assumed that, it's the hospice at a certain very definable point. It seems that job is done, but that's not how it works. That's interesting. Wow.
No. And so if they're in that unhealthy grieving, we get them more support. Our social workers get involved and they get more support.
Why 13 months?
Well, Medicare actually requires 12 months, but we do an extra month because that anniversary is very
Exactly.
triggering for some. And so we want to make sure they get through that.
My wife and her father, my father-in-law, just passed an anniversary with her mom's passing, and it's been like 6-7 years, and this was the first time. It's been 7 years, and this was the first time that kind of there wasn't a lot of of upset around the day. The day just kind of happened, and it took that long for that day to kind of lessen in significance for them.
Yes.
That's amazing, though, and that's why I asked, though. I know that the anniversary is such a big deal, and so to know that you're around for 13 months, that seems very thoughtful. That's really cool.
Yeah, thanks.
That's all I got. I turned it into a commercial, and I didn't mean to do that.
Okay. All right. Is there anything else that any other message that you'd like to convey that we haven't touched on yet?
Yeah, if anyone is curious about hospice, if they are curious too, if they want to know how they can help hospice, we always need volunteers. But two, if you think you or someone you love could benefit from hospice, just call us. You don't have to have your provider approve it. It's not a service that you don't need a referral for. This is one of those things you just call and say, hey, I'm ready to hear about what your service is. I may or may not be a candidate right now, but maybe when I am, I'd like to know what you're doing. My provider said I might not be ready, but I think I am, so I'd like to hear more. You can call us. It is a self-referral system, and we can help you walk through and navigate that.
So very patient-driven.
Very much.
What phone number or where's your office in town? How would people get a hold of you?
Yes, our phone number is 707-460-6191. And our office is located on the corner of H and 8th Street, right across the street from the VFW.
Okay.
And so either of those two ways, you can pop into the office or you can give us a call and we can walk through, some of those questions people have.
Are you in that Craftsman house that's there across the
No,
street?
it's not a Craftsman. It's a flat roof with, I think it was a doctor's office at one time.
I was thinking.
Yeah.
So is there any you talked about this as a self-referral sort of thing. Is there any sort of insurance issues people should know about payment and
Zero.
Yeah.
No, do not worry about insurance. Let us worry about it or lack thereof. If you don't have insurance, please call us still.
Really?
Yes.
In what ways can you work with somebody who is underinsured?
Well, we're a nonprofit, so
Okay.
that's what we do. If you can't pay and you don't have enough, we'll figure it out.
I am so sorry for forgetting that. I'm so used to everybody involved in
I
healthcare
know.
being for profit nowadays that it's refreshing, and I forget that you're a nonprofit.
Yeah.
That's what all right. Well, thank you, Jamie. Jamie Daugherty from Coastal Hospice. I'm done. Do you have anything else you need to ask?
Nope.
Yeah, that was really great. And
Yeah, it's super helpful. I think this is exactly the word I wanted to get out
Yeah.
to Del Norte. You guys have some power here. Here's a great resource. If you're in the sad situation, this is how you get your needs taken care of.
Thank you.
And
Yes.
thanks for the chance to learn about the business as well, which I didn't know had been here, longer than I have. So that's incredible. That's really cool.
Yeah.
All righty, Jamie, thank you so much.
Yes, thank you.
All righty,
Thanks.
Lynn. What's up next?
Oh, we're going to talk about Mad River Community Hospital and the plans to close the birthing center.
All right.
Dun, dun, dun.
That's the next health matter. Thank you very much, Lynn.